Hello class, my name is Oscar Paz for HIM 5370. The title of the reading I'm presenting is Knowing the SCOR, Using Business Metrics to Gain Measurable Improvements. Overview of the presentation. I'm going to start with an introduction, then talk about the shifts in business, creating a business plan, analysis, metrics, solutions, results, and takeaway and questions. Introduction. SCOR is an abbreviation for Supply Chain Operations Reference. It allows companies to define and measure their supply chains, determine where weak links exist in their processes, and identify how to make improvements. Supply chain definitions start with customer requirements, products, or geography. This allows a business to segment by customers and determine how to penetrate and gain market share. SCOR has two major categories: customer-facing or external metrics, and company performance or external metrics. SWOT is an abbreviation for goal and is an analysis of each supply chain. SWOT is an abbreviation for strengths, weaknesses, opportunities, and threats. The author presents the claim to the reader that applying practices from other industries can help hospitals gain a competitive edge and improve financial performance. Business shift. The author opens the article by describing a hospital in New York that had leaders change their business paradigm with benchmarks which led to improvements in service and operations. She states the hospital's motivation for change was their decrease in revenue and increased competition. They applied practices from other industries to identify products and services to gain competitive edge. Their goal was to achieve operating efficiencies and control costs. Creating a plan. To begin their shift in business, the hospital had to ask questions such as, who are our customers? How do we keep our customers loyal? How do we create a competitive edge? In the SCOR strategy, a business must define their supply chain. As a service provider, the hospital chose to define its supply chains by key customer care units like acute care, maternity, day surgery, emergency, and clinical care. The strategy also considered other customers such as affiliated physicians and referring hospitals. SWOT analysis. Remember that SWOT stands for strengths, weaknesses, opportunities, and threats. And below is a part of their analysis for their acute care supply chain. Strengths for newly renovated patient rooms, low patient-nurse ratio, and high patient satisfaction scores. Weaknesses were aging diagnostic equipment and low occupancy rates. Opportunities were loss of acute care patients because of ED inefficiencies and possible use for long-term care. Threats were rising labor costs, forcing staffing cuts, and hospital stays continually shortened or converted to outpatient. This SWOT analysis became the guide for administrators' measurement of performance and selection of improvements. Using the SWOT analysis, administrators also identified the areas that needed to be superior to their competitors, competitive edge, gain an advantage, better than most, or perform at parity, level playing field. Profitability metric. The hospital began by looking at profitability as a metric. Sources for this data were sites such as Centers for Medicare and Medicaid, healthcare industry markets, and professional organizations. Through this data, the hospital found that it was marginally profitable at 1.8% in comparison to other rural, not-for-profit hospitals that range from a parity rating of 2.2% to a superior rating of 7.2%. Cost metric. As mentioned previously, the hospital indicated that its nurse-to-patient ratio was its strength. But looking at cost benchmark data showed that nurse labor at 16.2% at the example hospital was below parity rating, which is at 7.2%. In this case, the higher the number, the worse the metric because we're looking at costs. This cost analysis showed that the perceived strength of the hospital came at a very high cost. Gap analysis. The administrators identified improvement opportunities by mapping the flow of materials and information. They identified some gaps. One gap was inventory, where it was determined that the hospital was stocking every department which was leading to the hospital carrying too much inventory. Another gap was having multiple handoffs where multiple touch points were identified as wasteful in the areas such as hospital staff and food tray delivery. Another gap was poor data integrity where paper records were causing duplications and isolated software needing information to be retyped. Here are some of the solutions the hospital implemented. One was calculating each unit cost and focusing on streamlining each process. Another, turning each process into a work order to track incurred costs by each patient. Another, use visual signals to pull inventory and transport patients. And eliminating paper processes that would centralize patient records. Here are some of the results the hospital saw. 2% reduction in overall drug inventory the first year. Improved scheduling saw a 21% increase in capacity in the MRI units. 8% increase in demand for MRI services from neighboring hospitals and clinics. Improvement in process waste in labs and procedural departments was cut by 40% by doing procedural preparation. Takeaway and questions. The supply chain operations reference or SCOR process used in other industries such as manufacturing can be useful in healthcare. The main components and actions of SCOR, as we saw in the example of the New York State Hospital, were to define and measure supply chains, determine the weak links in processes, and identify necessary improvements. Questions to follow up with this presentation are, were you surprised that the example hospital saw improvements in their operations? Do you think there is a healthcare setting in which the SCOR model would not work, for example, in physician practices? This is the reference to the reading, and this is the end of the presentation. Please leave comments or questions in the forum. Thank you for watching.